Before we get started, it's kind of important for you to know that spinal cord stimulation therapy isn't one procedure. It's actually split into two, which is the trial or percutaneous procedure and the perm or permanent procedure. And we're going to start with the trial procedure because that's what shows the doctor and the patient, and probably most importantly the insurance company, if spinal cord stimulation happens to be right for you. You see, the procedure doesn't work on everybody. And unfortunately, the only way to know for sure is to implant a trial lead like this one from Boston Scientific into your back in about a 45-minute outpatient procedure and then dial it in. Now, when I say dial it in, first I mean the doctor has to place the lead over the right nerve root that contains the right nerve fibers that run from the pain to the brain, so to speak. Now, on me, with lumbar lower back pain the way I had it, that right nerve root happened to be between T8 and T9, or the 8th and 9th thoracic vertebra. And it's usually that way on people with lower back pain. But on patients with other types of pain, the right fibers could be in any one of 30 different pairs of nerve roots that attach to the spinal cord. So it all starts with actually getting the lead to the right nerve root. And to do that, the doctor uses this. It's called a TUI, or a 2E needle, which is really nothing more than a catheter or a hollow tube that's wrapped around a stainless steel needle that gives it the rigidity it needs so the doctor can insert it and pierce through the fat and the ligaments and the muscles and everything that holds the spinal cord together on his way into the epidural space. Now, the epidural space is a long tunnel that runs the length of the spine. And it's the thing that houses the spinal cord, where 62 times nerve roots or groups of nerves specific to certain areas on the body, they branch off to serve and carry signals to and from that specific area. So the question has to be is, how does the doctor know when he's inside the epidural space, but he doesn't go too far in and hit the spinal cord? And the answer for that, quite frankly, is experience. His eye, his touch, his feel, everything that comes with doing this procedure a few thousand times lets him feel his way towards the epidural space without going too far into it. You see, everything is resistance-based, so the first few millimeters the needle goes in, his fingers are feeling the skin and the fat and the muscle, all pushing back or resisting against the pressure of the TUI needle as the point heads towards the epidural space. Now, he'll continue on down with the TUI needle until he feels himself getting close to the epidural space. And again, this is where the feeling comes in and the experience comes in. Because when he gets to within a couple centimeters, he'll pull the needle out and attach a syringe filled with saline solution to it that'll guide him the rest of the way. And he'll continue to push the hollow needle inward the last few centimeters, pressing down on the plunger at the same time to create positive pressure in the syringe, until he breaks through into the epidural space, when the resistance is lost and he feels the plunger release, pushing the saline solution into the epidural space. That's when he knows he's got a clear pathway into the epidural space, and he can start threading the electrical lead up through the catheter and toward the proper nerve root. Now, as you might expect, it's the guiding part that's hard. I mean, how does he know exactly where he is? Well, the first thing, the guiding's made a lot easier by the fact he entered the epidural space on a 45-degree angle rather than a 90-degree angle if he went in right at, say, T8 or T9. By going in at T10, it puts the needle at a 45-degree angle and makes steering the lead a heck of a lot easier. Second, the lead tip itself is angled, so twisting the plastic lead tail between his fingers changes the direction of the angled tip, and he can guide the electrode in any one of a number of different directions, up, down, sideways, all going towards covering the proper nerve root. Now, right about now, I'd imagine you're thinking a couple of different things. First, you're probably thinking, am I awake for all this? And the answer is really an emphatic no. Are you kidding me? I mean, why go through the pain when there's perfectly good drugs for that? And second, you'd be wondering, how does the doctor know when he's reached the right spot? And I'd like to say there's an app for that, but we haven't gotten that far yet. There is, however, a machine called a fluoroscope, which is really nothing more than an X-ray machine in real time that lets the doctor track the progress of the lead tip until he gets it right over the right spot. over the right nerve root. And he hears this little voice say,
"You have reached your destination."
okay, no, I'm kidding. There's no little voice either. We haven't gotten that far again. But he can see when the lead's over the right nerve root, at which point it's time to wake up the patient and turn the navigation duties over to the company rep, who's there because, let's face it, who knows the product better than someone who lives with it every day?
So you're saying you think that's too far lateral?
I just have a feeling, I mean, we can test them.
No, it's not that hard to move it. Picture?
The doctor will always have the final say, but it's like a director and DIT, or digital image technician, that we use on the set, like Randy over there. The director will always have the vision and the final say, but it's his DIT that's responsible for getting the most out of the cameras and bringing the director's vision to life. Well, in the OR, that's the manufacturer's rep's job. Kind of like the unsung hero who, even after the procedure is over, he's still available to the patient 24 hours a day, 7 days a week to answer questions or just be there for the patient to talk to. And I think that, maybe more than anything else, separates truly great device manufacturers from the merely good ones. Find a great doctor, and more than likely, you're going to find a great rep right behind him.
Great. Keith, you're doing a great job for us. Okay. So he's very jumpy. He goes from like 4 milliamps to
All right, so that trial leads in, now what? Well, now comes the fine-tuning. And for that, it's time to wake the patient up so we can help the doctor and the rep find just the right spot.